So one confusing thing for patients and for everybody who deals with venous disease or superficial vein problems in the legs is whether their problem is cosmetic or therapeutic, i.e. whether they have a potential health problem and something that will be covered by insurance, or whether it's just purely a cosmetic problem. So there's a wide range of veins you can have on your legs, from large bulging varicose veins to medium-sized small varicose veins and reticular veins to tiny spider veins. So the question is, do I have something that's worse underneath that needs a substantial procedure, or do I just need a cosmetic procedure? So sometimes it's difficult to tell right off the bat, but it's really different how we handle every patient depending on that. So what I tell our residents and fellows, for example, is one of the first things you try to do is you want to ascertain whether this is a cosmetic situation or whether this is a quote-unquote therapeutic situation. And so when we talk to a patient before they come in, if they say, well, I just have spider and reticular veins and they don't really hurt, well, then we know that's going to be a cosmetic situation, and we can offer the patients to come in and talk to them about how much it will cost and what we would do to get rid of most of their spider or reticular veins. If it's a patient that says on the phone, I have big bulgy varicose veins, I have achy legs, I have swelling, well, we know that that's going to be a therapeutic problem, and we're going to have to do a more substantial procedure to the vein underneath to get rid of that problem. In that case, every single patient needs an ultrasound. So they'll get an ultrasound either before or after they see the doctor in order to map out exactly what treatments they need. So usually when they have the big varicose veins with substantial symptoms, we consider that a therapeutic patient. They get an ultrasound. They often have to wear compression stockings for a period of months before their insurance company will often pay for the procedure. The cosmetic patients, we don't want to waste their time with all that. They don't need an ultrasound, so they can come in and either immediately get their veins injected, or we can talk to them and they can decide if and when they want to come back. So it's really important to understand the spectrum from cosmetic to therapeutic when you're talking about lower extremity veins.